Hello everyone, thank you for joining the session today. I can see Ian hasn't joined, he might be facing some internet issue. Ms. Davidson, I would request you to please take it further as we are already running out of time.
I shall do so, and thank you, Sonia. I'd just like to welcome everybody here today on this important week. I think Laboratory Professions Week is a week that we should all celebrate. We're all in the profession of laboratory medicine that plays such an important role in delivering a diagnosis, monitoring patients, and we need to celebrate the role that we play. So today we are going to celebrate that with a number of excellent speakers. And I'm not going to spend too much of your time here, but I am firstly going to call on Dr. Gizachu Tadesa Akulu to give us a brief introduction, and then I will go on to introduce our esteemed speakers today. So welcome everybody, and I hope you enjoy this session. So over to Gizachu to give us a brief introduction. Thank you. Over to you.
Thank you, Glinda. And I have to speak with few slides. And can I use share to screen?
I am sure you can. Sonia, is this possible?
Okay.
There we go.
Okay. Okay. So is it visible?
It is visible.
Okay, thank you.
Go ahead.
Yeah, thank you. And I think this event has been in the global picture for, I think, as far as I know, for the last some 10 or more years to advocate for laboratory medicine. So that I'm really thankful for your time and efforts to really create a single compelling voice for the growth and advocacy of laboratory medicine. Having said this, I have to say that how we get really here. When we see the history of laboratory testing, I think we need to start from the past. So when we see the history of laboratory testing, it's 100% the story of medicine. And the history of medicine is definitely the story of traditional medicine. Within that, there is an evolution from empirical to experimental and confirmatory techniques through along the way through the time, showcasing the laboratory as a critical element of medical decision makings. I don't want to really talk very deeply, but I wanted to touch few historical perspectives, how laboratory is evolved, how it's emerged. I'm just speaking the metaphor how laboratory medicine is evolved from medicine and medicine from traditional medicine, so that within these dynamics there are lots of historical perspectives, so that in the past physicians continued utilizing laboratory testing while laboratory scientists designed new tests and equally emphasized on quality. In the present, the lab technologists focus on dissemination of information, improving efficiency, and maintaining at the same time quality. And the future of the lab will be very much different from the past or the present. So the lab technologists will focus more on appropriateness of testing. And as there is personalized medicine, the choice of testing will also differ. And new technologies will also emerge, so that lab technologists will be also focusing on this new technologies, and we will lab technologists to also study on personalized medicine, on appropriateness of testing. So when we see the philosophy and the function of laboratory medicine, yeah, it can encompass. I may not mention all, but yeah, we are just lab technologists are involved in education. There is highly varied definition, but I'm just rather mentioning laboratory medicine professionals so that they engage in industry, in education, in service, in management, and in research. So there are huge tasks. And when we see the laboratory career paths, I think the famous one is just we can start from the phlebotomist to the lab manager and the lab director, so that the next presenters will really manage pretty much on these issues. But I wanted to simply touch all these things. So today the career path is very much widened to what a medical laboratory scientist is, what's molecular biotechnology, who will be involved in that, and what is a doctor of clinical laboratory medicine. I think there are, yeah, schools have been really opening directly to the doctor of clinical laboratory medicine, and the career path is just very much increasing every year, and there are a projected 11% of increase in medical laboratory careers between 2018 and 2028. However, there will be a great, and there is even currently a great disparity between the well-to-do countries and the low-income countries about the career path and progression. So today, laboratory medicine in every country review about quality, about effectiveness, clinical effectiveness of the laboratory testing, or cost effectiveness, analytical quality, quality assurance, and accreditation issues. And the other one is when it comes to the clinical effectiveness, where just laboratory medicine professionals really worried about the clinical outcome, the patient focus, and the timeliness. When it comes to cost effectiveness, the total cost value for money and its appropriate use is in a global picture, so that we are really wondering about documenting and speaking to create a single compelling voice on this. So there are, the current agenda is, this will be the last slide, I think, and the current agenda is understanding the pressure of medical laboratory, the scope, and the investment. So how harmonized the interaction is need to be very much clear in this, so that, yeah, there are a one health agenda in the global perspective. So are we ready, really, laboratory medicines, are we ready to respond to this global agenda? That's my really concern. The other one is we have to change this knowledge to really economy. We have seen that lots of methods have been developed even in-house in the laboratory. In fact, there is a great collaboration with industries, so that we need to understand the today's agenda, and we need to contribute more in the future, so that will be really fantastic. And the next presenters will present lots of topics on this issue, but this is what I have to say while we are celebrating the Laboratory Professionals Week. And finally, I'd like to thank the Empower Health and the African Federation of Clinical Chemistry and Laboratory Medicine as one of the Continental Society and a member of the International Federation of Clinical Chemistry and Laboratory Medicine. We know that laboratory medicine not only documented its progression, but also changed even the organizational scope and function. I can say that IFCC, since its establishment before 7 years, it was just focusing on clinical chemistry, okay? And through time, it has incorporated really the scope of laboratory medicine, and the African Federation of Clinical Chemistry and do also this incorporation and responding to this change, the global changing environment. So I would like really to thank the Global Health and individuals working in this, specifically and for advocating in such an agenda. So thank you.
Thank you, Dr. Akulo, for that introduction, which really reminded us of the opportunities that we have as laboratory professionals, and that we also need to evolve with the changing environment. So thank you very much. I believe that Ian, our organizer and driver, Dr. Ruretso, is in the room. So, Dr. Ian, would you like to say a few words before we go on?
Thank you very much, Glenda, and thank you very much, Giselle, for that insightful introduction. And I just want to thank University of Zimbabwe Department of Laboratory Diagnostic and Investigative Sciences, the Cape Peninsula University of Technology Department of Biomedical Sciences, the Stellenbosch University Division of Chemical Pathology, and the University of Pretoria Department of Chemical Pathology, which are in collaboration with the African Federation of Clinical Chemistry and Laboratory Medicine and Empower School of Health, known as the African Consortium on Laboratory System Strengthening, in championing this agenda of putting the laboratory on the forefront in terms of evidence-based medicine. And in light of the current crisis that we are facing, we noted the importance of the lab, and hence this webinar, as we celebrate the Laboratory Professionals Week, the need to talk about the lab profession in terms of the career progression and how we can be involved in the fight against viruses, which is one of the pandemics that we might be faced with as we continue to live in this world. So I would like to thank you all and thank our presenters, Geoffrey and Omuse and Witness Dobo, for taking their time to prepare, and all of you, the participants. And I would want to wish you a good day, and thank you very much. Over to you, Glenda. Thank you very much.
Thank you so much, Ian, for organizing and driving this. So without further ado, I'm going to introduce the first speaker of today, who is Professor Geoffrey Omuse. He's a very astound a speaker. He is presently the Associate Professor and Consultant of Clinical Pathology at the Aga Khan University Hospital in Nairobi. He is the former chair of the Association of Clinical Pathologists in Kenya, and he's a fellow of the African Research Excellence Fund. He's also presently with myself and Ian on the editorial board of the African Journal of Laboratory Medicine, and he also serves as the vice chair of the Faculty of Health Science Scientific Committee. And Geoffrey is going to speak to us today about pathology and laboratory medicine, and in particular career opportunities and progression. So we look forward and we welcome you, Professor Omuse, and you may take the floor and take us forward. Thank you very much for being here today.
Thank you very much, Glenda. I hope you can see my slides and you can hear me.
Yes, we can hear you clearly and your slides are very clear. Thank you very much. Go ahead.
Thank you very much. And I would also like to start by thanking the organizers for inviting me to make this presentation in a week that is really quite important for all of us who practice in the laboratory medicine space. So, yeah. So I don't have any conflict of interest to declare, and that all views expressed in this presentation are clearly my own. Really what I'm trying to share is really my own perspective of what opportunities are available in the laboratory medicine space, pretty born out of the fact I've been in this space now since 2008. And I think I would just like to share really my perspectives, which in no way will be exhaustive. I think upfront, I would really like to start first by debunking the myth of what pathology is. Oftentimes, when I have to introduce myself as a pathologist, I always have to clarify to people what pathology actually means. And so I would just like to reemphasize the point that when we speak about pathology, pathology actually is derived from two Greek words, pathos and logos, which put together simply means the study of disease. Oftentimes, people have a very narrow perspective of what pathology is. And so it's really good. I always take this opportunity to debunk and let people know that oftentimes pathology is really much broader and actually encompasses what traditionally we refer to as laboratory medicine. Now, just to put everything into context, this slide is basically the cover of a book that I really love, and I would really like to encourage everyone who is either practicing in the laboratory medicine space or who has ambitions of becoming a laboratory medicine practitioner. I'll really urge you to read this book. It's called Divining Without Seeds, The Case for Strengthening Laboratory Medicine in Africa. And this book basically captures the importance of laboratory medicine in healthcare. And the analogy used there about divining without seeds. I don't know how many of you watch Nigerian movies. Oftentimes you find that in some of the movies, you have someone going to see a traditional medicine man who throws seeds on the ground, and depending on the pattern of the seeds, they're able to tell what disease you're actually suffering from. And so this book actually gets into the details about how medicine is practiced in the African continent without the backing of evidence from diagnostic tests. A lot of practice is actually not evidence-based. It's more of what sometimes I call emotional-based practice of medicine. And so Iruka Okeke just makes a point that someone practicing medicine without proper lab support is like a traditional medicine man practicing his art without the use of these important seeds that are quite critical to their practice. So William Osler, or rather Sir William Osler, who is probably one of the most renowned doctors and actually one of the four founders of Johns Hopkins Hospital, actually made this statement that is so true, that as is your pathology, so is your practice, and basically emphasizing the point that you cannot really practice evidence-based medicine without proper support. So really, this really puts to the fore the importance or the critical role that laboratory medicine actually plays in healthcare. And as a laboratory practitioner, I think there's no better time to be a laboratory practitioner like now. And the reason I say that is that COVID-19 basically put us right in the spotlight. All of a sudden, because of COVID, everyone realized how important laboratory testing actually is. People were unable to hold meetings because of, as we're waiting for a laboratory test decided whether you travel or not travel. A laboratory test decided whether you're going to be quarantined or not, determined whether economies are going to open or not. And so I love the fact that COVID actually exposed the fact that African governments hadn't done enough to actually invest in public health laboratories. And number two, it actually exposed the fact that we actually need many more people to become laboratory professionals. And that without laboratory professionals, then truly we cannot pretend to be practicing evidence-based medicine. Now, if you look at the Sustainable Development Goals, and in particular SDG 3, it talks about ensuring healthy lives and promoting well-being for all at all ages. So you'll agree with me that this would not be feasible without emphasizing the important role that laboratory medicine and pathology play in this whole objective of trying to achieve health for all. And indeed, it's not just enough to have laboratory services. You really need to have high quality, affordable pathology and laboratory medicine services. And from this very lovely paper from the Lancet Commission on Diagnostics, they actually highlight 4 key areas that are important to actually promote good quality pathology and laboratory medicine services. And of these 4, workforce or human capacity is one that they highlight very well, which really is then the focus of my presentation today, the importance of a career in laboratory medicine and what opportunities are there for career progression. We do realize that in Africa, we do have an increasing burden of disease, both communicable and non-communicable, but at the same time, they're dwindling healthcare resources. And unfortunately, most governments in Africa are not investing as much as they need in healthcare, which of course then includes investing in public health laboratories and investing in healthcare as a whole, which is really quite unfortunate, because if you look at global statistics of workforce in pathology and laboratory medicine, you'll find that in sub-Saharan Africa, the number of lab professionals vis-a-vis the population is actually lowest in Africa compared to other places in the world. In Africa, for instance, if I am to specifically talk about, say, anatomic pathologists, one anatomic pathologist actually serves a population of around 1 million people, whereas in developed countries, one pathologist would probably serve a population of around 50,000 people. So you can clearly see, and this is actually true not only for pathology, but all other cadres of health professionals in laboratory, pathology and laboratory medicine. So indeed, there is a need in Africa, and in particular sub-Saharan Africa, for more and more people to get into this profession so as to promote in the long term attainment of health for all. So, but the barriers that have actually been identified to actually expanding access to pathology and lab medicine services, and as you can see, indeed, insufficient human resources and workforce capacity is one of those areas that really need to be addressed. And so then what is available in terms of scope? What are the areas then in pathology and laboratory medicine that one could potentially consider if you really want to join this space? So there's everything from offering the professional service, laboratory clinical service in a routine service lab, either in a hospital, a clinic, dispensary, etc. There's also academia, and I think this has already been alluded to, that there's a lot of scope in laboratory medicine in terms of training the next generation of laboratory professionals. Of course, there's administration and management. Incidentally, I always tell people that laboratory professionals, I think, actually make the best managers because they handle so many different resources, financial, logistics, people, that generally you actually become a good administrator if you've worked in the laboratory space. Quality management is really a big deal nowadays. There's a lot of emphasis around not just providing a laboratory service, but providing a quality laboratory service. And so increasingly, careers in quality management have become one of the areas of focus and specialization in pathology and laboratory medicine. Health informatics is growing and it grows by the day. And I'll later on talk about big data as one of the areas that has a lot of scope grow both currently and in the future. Research and ethics, inevitably, being in the laboratory space provides an opportunity to engage in research. And each time we talk about research, we must never forget about the ethics associated with research. A lot of talk nowadays about the ethics around sample collection for research, the utilization, the storage, especially when it comes to genetics. And really there is an opportunity there in that space for one to actually consider a career. And last but not least, and this list of mine is by no means exhaustive, is of course industry. I think there's a lot of scope for innovation and development of new tests, new diagnostic modalities. And all of this really can be considered areas of potential interest in the pathology and laboratory medicine space. So if I focus just on the traditional areas, I'm just focusing on the professional service, offering a service of laboratory testing in a laboratory for diagnosis. What are some of the sort of traditional areas of specialization? And I've sort of tried again to list based on some published work. So everything from clinical biochemistry to cytopathology, forensic pathology, hematology, histopathology, immunopathology, medical microbiology, molecular pathology, which has really become, COVID helped everyone become an expert in PCR and what those results actually mean, the pediatric perinatal transfusion medicine. So I will not get into the details of each one of these in the interest of time, but what one can truly appreciate is that the scope of pathology and laboratory medicine isn't what people traditionally used to think, that pathology is only about postmortems, for instance. But pathology and lab medicine is really very broad and really constitutes the study of disease in the very broader sense. And so everything as listed really encompasses pathology and lab medicine. So if you are considering a career in pathology and lab medicine, really based on your interest, the scope is quite wide. So what are the career opportunities available? If I was to attempt to actually indulge and take you through to every single career opportunity, I think we'd be here until tomorrow. This is just a summary that I present, and the intention here is not for you to actually read everything that I have shown. It's just to appreciate the breadth and the depth of opportunities in this space, and that and I'll be sharing these slides. So there's really quite a bit of opportunity in the pathology and laboratory medicine space. So I would just speak on three potential career paths. So I am a pathologist, and so I will speak about pathology first. So if you are considering a career as a pathologist, one requirement is that you need to have a medical degree. And so in Africa, that is usually a Bachelor of Medicine and a Bachelor of Surgery, either MBCHB, MBBS, etc. But to practice as a pathologist, you also need a further specialization, so a master's degree. Like so, I have a master's degree in medicine in clinical pathology. And so if you wanted to do pathology at master's level, become a consultant, there are various avenues available. When you look at even universities in Africa, you can either study a degree in general pathology or a degree in clinical pathology or anatomic pathology, or even a degree in any of the subspecializations. And then you become an expert or a consultant in one of those areas. Now, the kind of training that you would want to seek as a pathologist primarily would depend on, of course, your interest. And number two, where it is that you'd like to train. So by and large, if people want to go and work in fairly more rural setups where they require someone with general skills in pathology, then maybe a general pathology degree would be suitable. I do recognize that a general pathology degree is not offered in all countries in Africa. In East Africa, I think most of our degrees are general pathology. Places like South Africa, we actually offer degrees on the subspecialty. So you can get a master's in hematology, in microbiology, in chemical pathology, immunology, or a master's in anatomic pathology. So that is pretty much a scope in terms of what you want to do if you want to become a pathologist. And oftentimes, as a pathologist, you'll either be a lab director, or you'll be overseeing a section in a clinical lab, or many times people get into research work based on your interest. But yeah, that would be sort of your path to practicing as a pathologist. Now, the people whom I call probably the key personnel in any laboratory are your laboratory technologists. Now, I hear various terminologies in sub-Saharan Africa, or even in Africa as a whole. Sometimes in some jurisdictions, laboratory technologists are referred to as laboratory scientists. In Kenya, where I am, there's a distinction between a laboratory technologist and a laboratory scientist. So if what I say does not apply in your country, I apologize that I am sort of biased by what I've seen in the country where I am. So laboratory technologists, like in Kenya, can either be a diploma holder, a higher diploma holder, or a holder of a degree, either bachelor's, master's, or a PhD. And oftentimes they are registered as a laboratory technologist, and they're actually allowed to work even within a clinical setting. So they can work in hospitals, clinics, basically laboratories that are actually engaged in diagnosis. And so there are sub-specializations that are available across all the key areas of pathology and lab medicine. And I think if I was not a pathologist, I would be a laboratory technologist. And sometimes I envy that people, they actually handle samples more than I do. And so if you are considering a career in laboratory technologist, more often than not, they'll end up diagnostic testing, but there's also scope on ending up in academia, research, and even industry. In Kenya, and I don't know whether this applies in how many other countries this applies, laboratory scientist is a term that increasingly laboratory professionals who refer to themselves as scientists are increasingly becoming actually very key components of both diagnostic and research laboratories. I usually say that laboratory scientists are actually the drivers of research and innovation because they are actually the ones who oftentimes critically look at questions that are quite relevant. Oftentimes, laboratory scientists are usually discipline focused in the sense that you find someone has a bachelor's, a master's, or a PhD in either hematology or chemistry or histotechnology, etc. And I think as a continent, we haven't invested enough in laboratory scientists because you think about creativity, think about innovation, think about discovery science. I think we really need to invest more in laboratory scientists. Then we have very many support services, be it whether you are in a service laboratory, in a research laboratory. And this stems all the way from the very critical component of phlebotomy. I mean, any testing done in any lab is only as good as the quality of sample that you receive. And I always tell people that I think phlebotomy is such a key component of any laboratory diagnostic setup. And we actually need to ensure that people who are handling samples or collecting samples are sufficiently trained. Not all institutions are privileged to have phlebotomy services done by trained phlebotomists, but I think it is an area that we really need to train anyone who is collecting samples on how proper samples need to be collected. Then you have laboratory assistants and pathology assistants, depending on your setting, who basically help in various areas in the laboratory, including, for instance, preparing media, distributing samples, ensuring that laboratory spaces are well prepared for testing, etc. For forensics and morbid pathology, of course, we have a very important group of people who we call morticians who prepare bodies for dissection. Of course, I've emphasized the importance of administration. Everyone from your reception staff, from anyone who does any sort of management. I've talked about quality management. So quality has become a whole career path on its own. In the laboratory, nowadays we have quality officers, we have quality coordinators, we have quality managers who focus on the establishment of quality management systems. Given the amount of consumables and reagents that are used in laboratories, then it becomes supplies and logistics become very important. So you actually have people who actually focus on supplies and logistics of laboratory reagents and consumables. And so that again becomes another place where one can have an opportunity to focus on. The role of health informatics cannot be overemphasized because nowadays with big data and connectivity, and the introduction of electronic health records, the amount of information becoming available on an individual's health is increasing exponentially. And so there's a whole career around setting up laboratory information management systems, the electronic health records, to harness this big data to inform better decision making. And last but not least, I want to emphasize point of care testing and near patient testing. Traditionally, we have waited for samples to come to us in main laboratories, but nowadays there's a lot of interest in sort of devolving testing to as close as possible to the patient. And again, I'll say a few things about that shortly. So it is my considered opinion that pathology and laboratory medicine actually offers a great opportunity for innovation. And why do I say that? Because it is a space that is growing rapidly. Everyone does recognize that the amount of testing, for instance, done in Africa compared to what happens globally is very, very low. If I use COVID, SARS-CoV-2 testing as an example, if you look at the total number of tests, COVID tests done globally, only I think 25% of those tests have been done in Africa, despite that 75% of the world's population actually live in low and middle income countries. So you see there's a disparity in the amount of testing, and this applies across not only SARS-CoV-2, but I would dare say almost any laboratory test done globally. So there is a lot of scope for innovation, especially in the African continent, around access to laboratory testing. Now, total laboratory automation is a concept increasingly becoming, increasingly is required in large laboratories, even in Africa. And I think the adoption of these technologies is slowly growing. And oftentimes people have, at least from the experience that I have, in our lab, we attempted to do total lab automation. And I could see the amount of resistance that this actually met. And I had to sit down with my colleagues and tell them that don't look at total lab automation, where we're trying to optimize processes to increase efficiency and cut down cost. Don't look at that as a risk to your job. You look at it as an opportunity to develop other areas that are very key, that cannot be automated. And so what I'd just like to emphasize is that whether we like it or not, technological advancements are here with us. And as laboratory professionals, or as people who want to enter the laboratory space, we need to consider then how then do we take advantage of this automation and focus on other areas that are very key to ensure that we actually grow laboratory medicine. So what are some of these areas? I think I would just like to talk about two. One, I've already alluded to point of care testing and near patient testing. This has actually revolutionized testing, and I would like to just give two examples. GeneXpert, which is really a very complex technology harnessed into a very small box, has revolutionized people and revolutionized testing in Africa. Everything from TB diagnosis, and during the COVID outbreak, SARS-CoV-2 PCRs. And by so doing, it has actually created very many job opportunities for people, because now you have basically a molecular lab devolved to really the very lowest levels of healthcare. And as a result, very many jobs have been created. So on the one hand, we talk about increasingly, we have total lab automation coming to the fore, but the opportunities of growth in laboratory medicine. And I think point of care testing or near patient testing is another example. The other example I would like to highlight is down here. This small machine you see here, which is actually smaller than a mobile phone, is actually a nanopore, what we call, or an MK1B. Very small gadget, smaller than a mobile phone, but it's able to carry out sequencing. And if you speak to the founders of Nanopore, their vision is actually to be able to have sequencing being done even at the level of a district hospital or even a dispensary, as close to the patient as possible. And again, therein lies an opportunity for people who are interested in getting into the laboratory medicine space to actually grow careers around these technologies. And I think there's really a great opportunity there. I would like to share with you an example of innovation by someone who was actually a student of mine, who decided that there are very few pathologists in East Africa, and actually in Kenya, and how then could he ensure that the few pathologists in Kenya could actually serve a wider population? The challenge, of course, is that most pathologists in Kenya are actually located in urban towns or urban centers. But the need for histopathological diagnosis is actually countrywide. And so he came up with a very innovative way of using either couriers to send samples to him. He's located in a very rural county in Kenya, process those, take images of the slides, and share those images with pathologists in Kenya. So he actually calls his company the Pathology Network. And over the years, it has actually grown and has expanded beyond Kenya. And they're actually looking at sharing this service Africa-wide. So if you don't have a pathologist, but you're able to process tissue, you can easily scan your images. And there's a network of pathologists online who can actually review your slides and give you a diagnosis. So this is an example of innovation. And by so doing, he's been able to create an opportunity in the laboratory medicine space for many people, but more importantly, is able to serve a larger population just using this bit of innovation. So I think, yes, an example of how innovation can actually create opportunities for us. So what does the future hold? I think there are very many opportunities, as I've alluded to, but I would like to just mention one thing. So from where I sit, I marvel at how different industries globally have been disrupted. I marvel at how Uber disrupted the taxi industry. I marvel at how Airbnb has disrupted the hotel industry and made things much more affordable. I am of the opinion that the healthcare industry, and especially the laboratory medicine space, is very ripe for disruption. And I am showing a picture of Elizabeth Holmes. Some of you might know her. She's a former CEO of Theranos. Theranos is a company that was attempting to ensure that you could do multiple blood tests on a single drop of blood. Unfortunately, they were able to raise lots of money, up to $9 billion US. And at some point, she was actually the richest female billionaire, youngest and richest female billionaire in the world. Well, unfortunately, they got into problems and the company collapsed because of certain improprietary, certain issues around the validity of what they're trying to do. But I love the idea about being able to do so many tests on a drop of blood. And I think whoever sort of unlocks that, going to create an opportunity in the laboratory medicine space for growth and for career projection. So I still wait, and if any of you thinks you have any bright ideas, I think this is an area to focus on. How can we maximize valuable samples and ensure that we actually do as many tests as we can on the most minimal sample? I think that would be quite revolutionary. The second thing I would like to mention as I come to the end of my presentation is the role of digital health technologies. I mean, we cannot be blind to the fact that digital technologies are going to revolutionize how healthcare is actually practiced. And I've put there a photo of an iWatch. And the reason I do that is because a few years back, a colleague of mine was jogging in a forest not too far from our hospital. And as he was jogging, he got an alert from his iWatch that something was not very right. You might have seen, we Google whether iWatch can actually detect heart abnormalities. And so for this gentleman, his phone kept on giving him an alert that his heart rate was actually not correct. And he initially ignored it. He tried to walk some more in the forest. He was with his wife. And unfortunately, he was actually quite overwhelmed. They had to call an ambulance. He was taken to hospital immediately. And he was actually diagnosed with a heart attack. But because of the technology in the phone, in his watch, his watch was actually able to alert him that something was not right, just by monitoring his heart rate. So increasingly, whether we like it or not, digital health technologies are going to transform how healthcare is practiced. And I think for us in the laboratory medicine space, it actually offers us an opportunity to consider other areas of career progression. Artificial intelligence and machine learning, again, is also coming into the fore. In certain countries, for instance, pap smears, diagnosis on pap smears is actually fully automated. And they use algorithms through artificial intelligence and machine learning to actually come up with a diagnosis. And the same is actually extending also to radiology. So we need to be cognizant that increasingly, when we talk about areas of career progression in the laboratory medicine space, I think health informatics artificial intelligence, bioinformatics, data analytics are areas that we could also think about. So finally, anytime I speak to any group of people about career choices and career progression, I always want to emphasize the role that mentors actually play. I am where I am in my career because I have had not one mentor, but several mentors. And that indeed it is true that if I have seen father, is by standing on the shoulders of giants, as Isaac Newton said. So I urge you, if you're considering a career in laboratory medicine, in pathology, in that space, seek a mentor or mentors, people who just guide you and advise you on what to and what not to do. I think it's very important, and this applies across all careers. So in summary, what have I been trying to tell you in the past 20, 25 minutes? That one, I hope I've convinced you that PALM, P-A-L-M, or what I refer, which refers to pathology and laboratory medicine, is really critical for healthcare delivery. And I think COVID actually put us in the spotlight. And I think, as I've tried to mention, I think healthcare is ripe for disruption. I think there are very many opportunities. There's increased need for testing. I think the healthcare industry is really ripe for disruption. I think there's a need for governments to invest in public health laboratories, and I think that COVID again brought that to the fore. And therein lies, again, very many opportunities for career progression. So last and not least, I would like to then encourage anyone considering a career or what to do next after finishing high school. Consider exploring a career in pathology and lab medicine. It is interesting, it is exciting, and it is an area that really has an opportunity for growth. So those few remarks, really, I would like to say thank you very much. This is a photo of the hospital where I work, which is located in Nairobi. It's known as Aga Khan University Hospital, Nairobi. Thank you very much, Glenda.
Yes, and thank you, Prof. Omuze. It's been a pleasure listening to you. And I so agree with you that we are more vital now than ever before, and I think laboratory medicine is due for a huge change, and the opportunities in that change are great. And thank you for staying in time. So I just want to tell everybody that we keep your questions. We're not going to, I've got lots of questions and comments as well, I'm sure you have, but we're going to go straight into the next talk, and then we will have a roundtable discussion after that. So then all the speakers will be available to answer your questions. So without further ado, I am going to go to the next speaker, who is very special, and I thank him. It's Dr. Witness Zobo, and he is a senior biomedical scientist and head of department of the molecular virology laboratory at the University Hospital in Southampton, England. But what makes him really special is that he volunteered to work in West Africa during the Ebola crisis in 2015, and we know how tragic that was. And because of his work in Sierra Leone, he was in fact awarded a Medal of Bravery by the late Queen Elizabeth II. So a very, very special man. And as we enter the era of pandemics, I really welcome you, Dr. Witness Zobo, to this seminar. And he's going to speak about laboratory medicine in the fight against viruses, and what a topic for us right now, where we are in Africa and in the world. So I'm going to hand over to you, Dr. Zobo. We can see your slides, and I can hear you. So take it ahead.
Thank you very much, Glenda. Can you hear me?
I can hear you. There's a little bit of background. Could everybody mute themselves? Thank you very much. Now we can hear you. Please go ahead. Dr. Zobo, are you there?
Oh,
Yeah, thank you. We can hear you now.
So-
Thanks.
sorry,
Go ahead.
sorry. Oh my God, I don't know. I think the person.
Yeah, you muted.
I think someone is muting me.
Okay, you're not muted now. So
Okay, can you hear
go
me now?
ahead. We can hear you now. Thank you.
Oh, thank you very much. Sorry, I'm sure most of the things that I have said were not heard because I was on mute. I was just saying, thank you very much, everyone who has converged on this platform. Also, thank you, the organizers of this meeting, this seminar. It's quite important that we have these kind of seminars actually to introduce ourselves or put across the whole world what we do, our essentiality in our profession. So thank you very much, the organizers. And I just also want to say thank you to Professor Omuse. You have actually made my work so easy. That was profound. And I'm going to jump from one corner to another, just saying it liberal, because I know you have actually laid out the ground for me to speak more about what exactly happens in the lab. So my name is Witness Zobo. I am the molecular virology head and the senior biomedical scientist at the University Hospital Southampton NHS Trust in the Department of Microbiology, which is considered as pathology. So today I'm privileged and honored to talk about laboratory medicine in the fight against viruses. And I welcome you everyone onto this journey. Right. Right, these are the topics that I'm going to cover today. I'm going to actually define what a virus is. And also I'm going to just look at the virology tests that we do in our lab at Southampton General Hospital. So our virology lab is quite big, and it's divided into two: molecular virology and serology. Also, I'm going to just talk about the recent viral pandemics, because I think it's the talk of the day, the talk of the season, the talk of our generation. And I'm also going to talk a little bit about the lab methods that are used for virus diagnosis. And I've got an interesting case study that I'm going to share with you at the end of my talk. I picked this case study because it's quite vital. Of course, we know about the pandemics, but there are other things, there are other viruses that are causing issues in our society, in our community, especially in Africa. I'm not disrespecting it, but I'm just saying these are the kind of things that we face. And also in Professor Omusa, he was actually talking about investing into public health. There are limited resources in public health, especially where we come from. Basically, just a little bit, I worked in Zimbabwe. I have been in the lab for 29 years now. So I worked about 10 years in Zimbabwe as a biomedical scientist, then came up over here. So I have got a good comparison of the two areas, Africa and here, seeing how much resources are actually invested in public health laboratories. So I have worked at this hospital where I am for 20 years now. Right. So what are viruses? Right. So viruses are a group of pathogens that are quite difficult to actually describe. They are a complex and diverse group of organisms that may have incredibly and ancient origins. Their interaction with humans not only involves disease process, but also evolutionary pressures that shape viral characteristics. And to describe or to define viruses, there are actually theories that come out and to describe them or to define them. The first theory is the first, there are theories or hypotheses. The first hypothesis actually suggests that viruses have ancient origins and arose before the last universal cellular ancestor. And another theory or hypothesis is the escape theory that postulates that viruses evolved recently and arose from genetic elements that escaped from cellular hosts and evolved independent replication of processes. And this, there is also what is called the reduction hypothesis. This actually contrasts the escape theory because it suggests that viruses are the remnants of cellular organism. So viruses actually, they encode genetic information either as DNA or RNA, and this information is stored as double-stranded versus single-stranded. So you have got double-stranded DNA, single-stranded DNA, double-stranded RNA, and single-stranded RNA. Although viruses contain information, their evolution requires host cells. So viruses do not survive without being in host cells. I remember very well during the peak of the pandemic, we used to have one virologist who would come to update the nation on BBC. I like the statement that he used to say. He said, viruses, this kind of virus like the COVID virus, it gets excited when it sees a group of people. So he was actually telling us that we don't need to be in groups. That's why we had this lockdown where people were not allowed to be together. So viruses cannot survive without having host cells. There are parasitic agents that infect cells to reproduce virions and disseminate genes, and they cannot maintain or replicate without hosts. So without hosts, viruses will not survive. Viruses are living organisms that replicate in the form of information, which is in contrast to all other forms of life. All right. I was just giving a brief definition of what viruses are. So in our laboratory at Southampton General Hospital, we have got actually about 5 sections of the virology laboratory. We have got the molecular virology, which I am the head of. We have got the Alinity, Gene Expect, and Biofire. There is another person, another biomedical scientist who actually had that. Then we have got serology, and we do quite a lot of samples. Our lab is our hospital is one of the largest hospitals in the United Kingdom, and we are actually a referral center. So we receive thousands and thousands of samples, and we do hundreds and hundreds of samples per day, molecular tests of different types of viruses, which I'm going to show in the coming slides. So we, in the molecular virology, we use the PCR to investigate a range of clinical samples for the presence of nucleic acids sequence that are specific to the following pathogens. So this is what we do in our lab in the molecular virology that we lead. We are responsible to test SARS-CoV-2, and also we also do quite a lot of other respiratory viruses. You know, SARS-CoV-2 is part of respiratory viruses, so we do quite a lot. And right now we are coming from winter into spring, and during winter we have got high cases of different types of respiratory viruses, and all of these we test them at molecular level. So we also do influenza A and B, we do RSV A and B, we do human metapneumovirus, we do para-influenza viruses 1, 2, 3. We also do human rhinoviruses. Some of us, we may not have about them, but there are quite many. We also do Hep simplex 1 and 2. We do varicella zoster, which is chicken pox. We do human adenoviruses, HIV, Hep B, Hep C. We also do enteroviruses. Then we also do human parechovirus, measles, norovirus 1 and 2, CMV and EBV. CMV and EBV is quite a big deal here in our hospital. We do quite a lot of them because we have got a very huge clinic on hematology patients and patients who have gone through bone marrow transplant. So we do a follow-up on these viruses and we test them at molecular level. Actually, we do quantitative because they want to know how many copies the patient has if they have one. And also, besides us being a virology department, we also do bacterial targets. So we do the meningo, we do the syphilis, do chlamydia, we do Neisseria gonorrhea. And the following slides are for the serology tests. There are quite many. So I'm just gonna go through the slides. As you can see there are quite many tests that we do in our serology department. Like I've already said, that we receive thousands of samples. It's quite a big laboratory. So all these ones are actually serology tests that we do. Quite many of them. Now, we have been, what can I say? We have been exposed to recent pandemics. And this pandemics has actually brought out how essential we are as people who work in the lab, how important laboratory medicine is in fighting against this. We know in 2014, there was an outbreak of Ebola in West Africa. It was difficult, it was dangerous. And we know from what was happening there, because of the resources that the local government has and the number of health professionals, we know most of those countries were affected. They actually lost about half of their medical professions because they did not know how to handle this. They were still learning on how to handle it. And the government abroad, they actually then set some processes, training people. And I was one of the persons who actually volunteered. It was actually volunteering to go to West Africa. It was dangerous. From our hospital, I think it's a very big department, pathology in our hospital. I think we range about 500 people who work in the lab, but I think there were only 2 or 3 people who actually volunteered to go there. And to say what happened, we actually, because it was volunteering and this had nothing to do with our workplaces, it was just going there. There was no remuneration. We just say, let us go and help because we had the expertise, we had the techniques. So in 2014, we went to West Africa. As if it were not enough, recently in 2019, we had the COVID-19. And also recently, there was something that was coming up, the monkeypox virus. Some people may have heard it. There was a time when the cases were increasing and health professions were running here and there to try to find what they can do. In our lab, we managed to develop the process, but the cases have gone down. And then we stopped what we're doing. We are now sending the samples to reference labs. Just a brief about the Ebola virus. So it's an RNA virus. It has got a very high mortality rate. 83 to 90% who get infected, they actually die. It's a risk group 4 pathogen. It requires biosafety level 4 equivalent containment. It affects people living near tropical rainforests. The symptoms we have heard about Ebola virus. So these are the symptoms. Because of my time, I'm not going to go through each one of them, but these are the symptoms that we have. But most importantly, the one that I want to mention is that these people, they actually have serious internal and external bleeding and organ failure, and this is what kills them. Ebola transmission, I'm sure some of us know, some of us do not know. Actually, the fruit bat is the primary carrier. So what it does, it eats fruit, but it does not become infected. Then the fruit becomes contaminated with Ebola virus. So we go and eat it, other animals eat it, and we become infected. Monkeys, chimpanzees, and gorillas and porcupines also are actually carriers of this virus. Fruit bats and monkeys are actually eaten in tropical areas. Where I went to Sierra Leone. I remember the guys who were working, the local people were actually saying monkey is a delicacy here. The place is mountainous. And they said, if you go to these mountains, you rarely see monkeys because we like it. So people may get it through eating monkeys. And this is the main culprit, the fruit bats. This is the kind of samples that we were receiving. So we would receive 4 samples at a go. One will be the swab, one will be for chemistry, one will be for malaria, and one will be for FBC. So because the patients who are infected with Ebola, they also have almost the same symptoms as someone who has got malaria. It was mandatory that we would then test malaria together with Ebola. And our essentiality was actually found in the hospital, or in places where people were actually brought to. If people had actually symptoms from their villages and everywhere, they were actually put in a confined area, and people would come there either with malaria and other symptoms. Anyone would actually come up with those kind of symptoms that I've showed previously will be grouped together. So as the lab, we were supposed to give results as quickly as possible, so that people who do not have the virus may be quickly separated. So this is why we were having a malaria. So in many cases, would actually find that some patients would have malaria, and what would happen, they may get the Ebola because they were put together with the people who had got the virus. So this was the challenge that we're facing. So we, as biomedical science or as lab medicine people, we were supposed to give a correct diagnosis so that these patients would be quickly separated to prevent further infection cases. So that was me. Like, it was like going to war. At the reception, you were actually locked out, and you were supposed to be fully gowned. No space within you. Yeah, it was like you were isolated if you were receiving samples. So they would lock you out. And before you come back into the lab, you're supposed to have a full decontamination. And you needed someone, actually, when you were taking off you needed someone to actually help you to take off, or donning and doffing. You were supposed to do it with someone to help you to make sure that there is no space that may allow you to get infected. That's me at the reception again. And now this was the lab that we were using. We were actually using a makeshift lab. So we had an isolator. This is where you would take your samples in. You actually inactivate your samples using chemicals and also heat inactivation. Then you bring them out. Once you inactivate, it means you don't have viral components of the virus. Then you can bring them out to start testing them. These were the colleagues I was working with. I'm trying to rush. It talks about the isolator, the film isolator that we were using in the lab. Right. So this was the extraction room where I would extract the nucleic acids from the viral RNA. We used the automated platform called the EZI. We would also use the manual techniques to actually extract the nucleic acid from the RNA. So you'll find the automated one was actually a bit slower. It would take 45 minutes, and the manual one would take 20 minutes. So you'll find we were doing more manual extraction because we wanted to increase our turnaround time, as many people were coming to this recruiting center where people were just put together. So we needed to have a quick turnaround time so that people could be, if those who were infected would be separated from those who were not infected. So the lab was opened at 6 in the morning and closed at 12 midnight. So this was our master mix room. That's the clean room. This is where you actually mix your extracted RNA and your probe and primers. I'm just rushing. I'm not going to explain everything because of my time. And this were the apparatus that we were using. So that is the tube where you will add your sample, and you add your primers and probes in there, and then you put it in a smart cycler, which was in the PCR room. So that was our PCR room that we were using. And on here is an example of the results that you get. I think there you have got 4 positive results. That's the amplification. When you see something like this, it shows the amplification of the results of your results. Oh, sorry. So you can see there are actually 2 which are actually late, and we needed to determine what was causing that. So you've got 4 positive samples, and one of them is a positive sample. And this is how you would use your controls. So you have a positive control, a negative control, and a negative extraction control. Your negative extraction control, when you are doing viral extraction, it helps you. It actually controls your extraction process. Is an MS2 is a non-pathogenic viral material that you add to every sample, and it should be amplified at the end of the at the end of your process. If there is no amplification, it means either one, your reagents have failed, or there was no extraction that took place. So that is an example of how a positive result will come when you are doing your result interpretation. So a positive sample, let's say A, will be positive for Ebola and positive for MS2. Sometimes it will be positive for Ebola and negative for MS2. The reason why it may be negative for MS2 is because if you have got a very viral load, the viral load will actually inhibit your MS2. Right. That's the team that I was working with, that we trained. This one, we were actually at our training center here in the United Kingdom before we left. That's me when I was outside the hospital. We were actually in a place called Kerry Town. So there was a makeshift, and it was actually monitored or administered by Public Health England. So that's the area of view of the makeshift hospital. And this hospital was actually sponsored or funded by organizations from here in the United Kingdom. And these organizations are the ones which actually trained us here, and all the equipment and everything that we're using came from this side. So this is the team I was working with. For the 5 weeks we were there, we only had 3 days off. So every single day we were in the lab. We were 15 of us. So we only had 3 days off. So these were the last 2 days before we came back. This is us at our hotel. And because we wanted to bring some souvenirs, we went for a peninsula, and I bought a souvenir to bring about with our colleagues. We were actually in a canoe. It was funny. Local food, I love the local food from Sierra Leone, although it was spicy. So at the hotel we were living, we were not allowed to mix with the local population, but we could see them doing fishing. They do quite a lot of fishing in Sierra Leone. And one morning when we came to the lab was surrounded by fire, and it was scary. But thankfully there was a fire guard that was actually around the place. Otherwise, that fire could have affected the hospital. And this was the road that we used to trek to go to and from where we lived to the hospital and where we lived. And this place, the reason why I put this one, Big Water, I asked, why do you call this place Big Water? They said there was quite a lot of water here. And when I looked around, that's just a small ditch as you go beyond. And I said, well, so I really liked this name. And it was my favorite place each time I was passing that place to go to my work to my workplace. SARS-CoV pandemic, we all know about this. This is what has happened. And we, as laboratory scientists, we actually test or we detect the proteins that are found on the surface of this virus. We know the symptoms. Because of my time, let me rush. These are the symptoms for SARS-CoV-2. It is actually the method that we use. We use the PCR method, and there are other tests that we use actually to do diagnosis. In our hospital, this is what we have. And this machinery is not expensive. I just want to go back to what our Professor Komiso was saying. These are the machinery that we use, and these are the kind of things that we should invest in our local hospitals, in our local laboratories, to have efficient diagnosis of all kinds of viruses. So this one is a robot that combines two technologies, the Kingfisher and the Hamilton. So the Hamilton is a robot that makes your reagents, and the Kingfisher Presto is actually the platform that do extract for you. So you just put your aliquoted sample there, then the system will extract your virus. You just take your elution plate and you take it to the next room. And this is called the Kaya Symphony. This is one of the platforms that we use to actually, the first one that I showed you, the Nimbus and the Presto, it is the one that we implemented. It's a quick, because of the number of COVID-19 samples we were receiving. It takes only 18 minutes for extraction, and it takes you about 30 minutes for aliquoting because you do it manually. It's one of the cheapest that we use. I think most of hospitals were using these big machines, but we went into in-house. So it was quite cheap, and we uploaded by what we were using. And I'm sure this can be used also in other places who do not have enough resources. So for this one is the one that we use to actually extract the chiasm from all the other viruses that I talked about. But the Nimbus and the Presso is for the SARS-CoV-2. But we are now developing, because this chiasm takes longer time for extraction, and the Kingfisher takes about 18 minutes. So we are working on the new workflow. We are changing. This one takes an hour for extraction. That one takes 20 minutes. So we are going to put all our viral extraction on the Kingfisher because it's fast. So we are busy working on it right now. So that's me ready to work in the safety cabinet. Those were samples that we faced. These are about 96 samples on there. That's me working there. And that's me. That's the next room. That's our master mix. This is called the Agility room, where we do our master mixes, where you make your primers and probes, then you add them to your samples. So what that machine does, the Agility, it's quite simple technology which we can implement. The Agility calculates your reagents, how much you need, depending on how many samples you are doing, how many tests you are doing. Then it also adds your reagents into the PCR plate. It also adds your sample into the PCR plate, mixes it. What you need to do, just take out your plate, you seal it, and you take it to the next room. That's the next room. This is our PCR room, and we use ABI 700. We have about 6 of them because we are a busy laboratory. We have 6 of them, and we have also other. We have 6 and 4 different platforms from Kingfisher. This is from ABI. So this is what you will get when you are doing your COVID. This is showing your internal positive control. Like I said earlier, all your samples, you add the internal positive control, which is the MS2. So for your successful extraction, this is what you are supposed to observe. I could have said more on that, but because of my time, I have to jump. This is what you use when you are trying to troubleshoot. In case your amplification is not quite clear, you take it to log view, and it actually tells you, especially if you have got late CTs. This one is showing a positive result from the COVID-19, and this one is showing a late result from COVID-19. Right, my case study, I'm trying to rush now. My case study is called common but rare severe infection. Right, a pregnant mom, right, had an emergency cesarean operation because her membranes had ruptured. The mother was not in labor, but her temperature was at 38. A premature baby girl was delivered, but 2 weeks after birth, the baby was unwell, and the baby was actually admitted into NU with the neonatal unit with suspected infection. The clinical diagnosis was signs of respiratory distress, and the patient was the baby was put on a high flow of oxygen for 1 day. A CSF was taken. I just want to show you how important we are as we are celebrating our week. A lumbar puncture, that's LP, was taken. The CSF looked normal, but then an infection was actually confirmed by the lab PCR results, and the patient was positive. The baby was positive for parechovirus at CT 33.5. I'm sure some of us have heard about parechovirus, but some may not have. I'm going to talk a little bit about it in my following slides. So due to the age of the baby, the infection was suspected to be acquired postnatally. Her older sibling visited the unit and was mildly unwell. So the baby was isolated in incubator, but was not intubated. There was good contact hygiene was strongly recommended. So the diagnosis that they found that the baby had brain hemorrhage, which was mild. Also, the baby had seizures. Baby had clinical seizures with eye rolling, but no changes were detected on the cerebral function monitoring. So the MRI had showed the baby had developed significant brain damage. So this virus actually causes brain damage. And from this, on this baby, it had significant brain damage. And it also showed that the bilateral matter was consistent with the parechovirus encephalitis. We do test quite a lot, especially from any neonatal babies who come to our hospital. Suspect who have got the clinical symptoms, which I'm going to show in my following slides. We do quite a lot of this testing. So the doctor suggested to have an MRI after 4 weeks. So the pediatric infectious team had some discussion with our consultant virologist. So we have got a consultant, like what Professor Omuso was saying, we have got a consultant virologist. They discussed the potential of giving the human normal immunoglobulin as medication. So the human normal immunoglobulin is made from plasma of about 1,000 donors, and it provides antibodies against the virus. We need to know that there is little or no medication for viruses, but this one helps actually to fight against viruses. So this treatment option is not free from risk, and its potential efficacy is still doubtful. So the consultant virologist went on to have further.
Just to let you know, if you can, you've got a minute or so to round up. Apologies, because it's very interesting. It's just that we're running out of time.
All right,
Sorry.
all right.
Thanks.
That's all right. Thank you very much. I think because of this, it's quite difficult. I can't finish, but I just want to say we managed, as Lep said, we managed to find what this baby had. This baby was looked after very well, and the baby is well. Right. So what is parechovirus? It is an RNA virus. It's part of the enterovirus. The most common one is called parechovirus A3. It spreads through breathing, coughing, sneezing. It can also spread through saliva and feces. It can also be spread through cutlery plates and toilets. Infection is extremely common in developing world due to poor hygiene. That's one point that I wanted to put across. And I don't know how many of us are testing this, just rushing. Again, we do not test much of it, so we don't know the exact number that people a number of people who are affected. These are the symptoms that these children have, or these infants have. These are the symptoms that they have. And once they come to these symptoms, we quickly do this test, and it causes seizures, meningitis, sepsis, and encephalitis. Management, there's no definite treatment, but the physicians, they try immunoglobulins and that drug, but that drug is not being used because it has not been found to be effective. Still about treatment. So these are the samples that we receive in the lab if you are investigating this virus. So swabs, either nose, throat, eye, biopsy, mouth or lesion, blood, feces, and in our case study, it was a CSF. In this case, serology is of limited use. So PCR is the most common test to detect the parechovirus. The references, and thank you. Sorry, I was a bit rushing to try to just bring up together the things that we have. Thank you, everyone. Thank you, the organizers, for giving me this opportunity to talk about what we do in the lab as we are celebrating our week. Thank you.
Thank you so much, Dr. Zobo, and apologies for making you rush. It's just that we are on a tight schedule and we're a bit late, and I would like to open up these presentations for discussion because I think they've both been excellent. They've both shown how laboratory professionals work in a laboratory and the essential role we play. And I congratulate you, Dr. Zobo, on the role that you play. But now we have got some time left, and I'd just like to mention and name the people on the discussion panel. It's Dr. Akulu, who you've met before, Dr. Bettina Charlie Matsao from the University of Pretoria, and she is part of the panel. Prof. Rajiv Erasmus unfortunately sent his apologies. He is in Botswana today giving a lecture. And then, of course, Dr. Ian Ruretso our host and driver of this whole seminar. He's also on that panel, and of course the speakers. So I'd now like to open up both these talks to questions and discussion points. Does anybody have a question or comment to make to the panel and to our speakers? Perhaps I can start the discussion, and this is to everybody, and something I've gathered over the last few years, and I think both speakers have brought it out, is that the overlap among specialities. I think Prof. Umuze brought up the thing that we tend to specialize. I'm a hematology specialist, others are chemical pathology, and we've got a virology, but everything is becoming integrated. And in South Africa, we're going through a huge debate now about, because we are highly regulated, where if you qualified in virology, you must stick to virology. And I think it came apparent in the COVID crisis where they were short-staffed in virology, but somebody who had qualified in hematology, who knows how to do next-generation sequencing, wasn't allowed to go and help doing COVID tests because it was a virus. So now this has opened up a huge debate, and I'd love the opinion of anybody, the panelists, Prof. Umuze, Dr. Zobo, on that. Do you think we should become more integrated across specialities? I don't know who'd like to take that question.
Can I start there? Just a brief.
Yes.
I think that's one thing that I could have talked about. I am not a specialist in virology. I'm a multidisciplinary trained biomedical scientist, and in this here they actually promote that. So they are able to move me around. So for my 20 years at University of Southampton Hospital, I have worked in microbiology right now. I've worked in biochemistry. I've worked in hematology. I have worked in transfusion. I have done coagulation, not for 1 year, but for almost 10 years in hematology transfusion. I've worked in immunology. I've worked in flow cytometry. So I think integration is quite important, especially with what we are facing now. Because these people, if they are trained, they can quickly move in and help out a situation. That I went to microbiology from immunology to help in virology, because I had the experience of when I volunteered to go to Sierra Leone, I was not working in virology, but because I had the knowledge of what we were dealing with, so the training was quick. And when I came back, and when we had the pandemic in our hospital, they said, oh, this is a challenge. We have someone who went to Sierra Leone. Can you come and help us? And when I went there, I helped. Then I was made actually the head of the section, but I wasn't from there. So I think integration is quite important. Thank you.
Yes, no, thank you. I wonder, Prof. Umuze, do you have an opinion on integration of specialities across disciplines?
Yes, thank you, Glenn. I think there's no easy answer to that question. I think what is oftentimes, unfortunately, there's a lot of ring fencing that guides some decisions around what one should and should not do, and not necessarily individual competence. And so I think we need to focus on competence. Of course, training is absolutely important. But as you mentioned, I think COVID taught us if you're more integrated, then you can maximize the little resources that you have. And I think we have examples even in Europe and even in North America, where even non-lab professionals were actually called to do molecular testing. People had to pivot just to produce a result. I mean, it's not that I'm advocating for that, but I think integration is important. I think we need to move away from ring fencing professions purely for selfish reasons. Oftentimes, this is done for selfish reasons. I mean, in my country, for instance, the people who identify themselves as laboratory technologists don't want laboratory scientists to be registered to work in diagnostic labs. And you ask yourself, what is the difference between testing for HIV in a research lab and testing for HIV in a diagnostic laboratory. It's the same technology, but because of ring fencing, someone says no, scientists should only be limited to research laboratories. Yet they have the expertise to actually, so, and a lot of this is driven by, I'm sorry to say, a lot of selfishness. And so I think I would promote integration. Globally, we are saying, and even in Africa, we are saying we don't have enough laboratory professionals. So we don't have the luxury to pick and choose. So I think we need to integrate. I think I would encourage generalists training, then subspecialization later, than just starting specializations from the very beginning. And then that way, then you actually have people who, if required, can easily pivot and support, especially in scenarios like where we do have pandemics. So I'm not a fan of ring fencing. I'm a fan of integration. I think that is how we need to move if you want to go further. Thank you.
I fully support that. Are there any other opinions on that issue?
Hi, Glinda.
Yes, I can see
Yeah.
Dr. Chala Matso Bettina. Your hand is up. Please go ahead, and then we'll come back.
Thank you.
Tina?
Thank you very much.
Go ahead.
Yes, can you hear me? Thank you very much. I just
And
wanted to add also on what you just said now, and also Prof. Omosu has indicated, and good morning again, Linda, Prof. Davidson. Thanks for chairing this nice session. I want to give an example of what happened during COVID. We saw across the world that clinicians were actually clubbing in to help each other to manage their patients. And we know that these patients were probably easier, or people who are basically on the ground all the time would be the physicians, for example, and the those are internal medicine people, basically. And our primary people would have been the anesthetists. But what did we see? We saw surgeons, we saw pediatricians, we saw endocrinologists, we saw everyone clubbing in to actually manage patients. So if we develop that in laboratory medicine, we have, for example, a scientist in our section. I'm a chemical pathologist. We have a scientist who's actually a molecular expert, but she couldn't work during COVID to actually to assist in analyzing COVID samples, because she's not a virologist. She's a chemical pathologist, if I may put it that way. She's not a chemical pathologist, but she's a biochemically trained scientist, but she's a molecular scientist, meaning that she could actually lend a hand to help in the state of need. And we're not very far from the next pandemic. We can see the current time that we have so many things happening, as Dr. Zobo has indicated now, that we are actually at any one time on a time bomb regarding what is the next thing that's going to hit us. So I definitely support integrated medicine. I don't believe in little exclusions of silos working individually as a chemical pathologist doing only sodium and magnesium. Thank you so much.
yes, thank you very, very much. I think I can see people are agreeing, and it's really red tape and all of this that prevents us from actually integrating fully, and maybe competence is the word rather than that registration. There is a question on the chat, and perhaps the person who put it there can talk a little bit more about it. I see it says integration is important. I have a question. What's the procedure if one wishes to continue a hand-on bench experience in Southampton molecular biology? Sorry?
Linda.
Yes.
Yeah, I think before going to go to the next question, I have few reflections on your opinion.
Yes, so, please go ahead.
Yeah, I think we have to see from, I wanted to look into from two perspectives. This highly varied specialization will be good for the patient and will be also good for the professionals. In terms of when we look into, in terms of the career of, or the paths of for the professional, specialization is really very important, and as well as it's also good for the patient. And my question is, not question, in fact, my opinion is the only and the most important driving factor for this disruption is advances in molecular biology. So advances in molecular biology is common to pathology, and it's also more common to laboratory medicine, whatever the specialization is. It could be virology, it could be mycobacteriology, it could be any bacteriology. For example, I am a medical laboratory technologist by generalist, and I specialized in medical microbiology and in diagnostics and public health microbiology. Currently, I'm working on molecular biology. Okay, so specifically, I'm working on mycobacteriology, so that we're just working with virologists, with any of that bacteriologists and other professionals in a common platform in a molecular biology. But what's more important for the patient is for the generalist training. The medical laboratory technologist is very important, and the other one, the pathologist, is very important for the patient as well as for the career path. So we have to look into different perspectives, and we need to recognize the driving factors, and we go for the integration in this regard. So I'm just looking from this perspective.
Those are very important opinions. Thank you. And I agree, specialization is still relevant, but possibly the basic qualification should be a generalist and then specialization. So I think I'm hearing that as well. So thank you very much. I don't know if there are any other comments on that, but we are getting quite a lot of questions on the chat, and I want to give those times a time. So the first one is directed to Dr. Zobo, and I think I read it out. It's, what's the procedure if one wishes to continue a hand-on bench experience in Southampton Molecular Laboratory? So it's specific to your laboratory. I'm not quite sure what the person is asking, but Dr. Zobo, would you like to take that?
Thank you. There's one thing that we need to remember, or for you to practice in the lab, in a diagnostic lab, you are supposed to have gone through, you're supposed to be registered with the Health Profession Council of the United Kingdom. That's the first step. So anyone who works in our department has to have that. If you are not, you actually work. We have got band levels here. There is what we call band 2 to band 4. These are non-registered people. Then from band 5, they are supposed to be registered. So if you are not registered, I'm asking specifically to me, if you are not registered, and you can try to get registered with HCPC. HCPC will tell you what do you need to do to meet their criteria. Specifically, if you want to work bench hand-on in our lab, they advertise, if you are not registered staff, they advertise band 4 to band 3 jobs regularly. This has got a very high turnover, so they advertise them quite a lot on the NHS platform. So you can find that there are jobs that you can come in, even if you are not if you are employed by the hospital, you can come in and you can work, and you can find a way to get registered, or you can come to have a tour and see what it is like. You are allowed to come and have a tour. Thank you.
Thank you very much. The next question on the chat is directed at Prof. Umuze. I have a question for you, Prof. Umuze. It says, since you talked about career progression in Africa, what opportunities are available for advanced biomedical science managers interested in international experience in Africa, particularly Kenya? I don't know if you'd like to take that. Go ahead.
Yeah, thank you, Fatima. So from the question, it's not easy to tell whether the question is in relation to furthering the academic career or in relation to actually getting work experience. So I would just comment and say, yes, in Kenya, I mean, I think, and not just in Kenya, I think many African countries have degree programs where if you have, say, either a diploma or higher diploma or a bachelor's degree in medical lab science, that you can actually seek either master's, even PhD, and even a postdoc opportunities. And I think those are readily available in many African countries. In terms of gaining international experience, if you want to work in a country, say like in Kenya, we're no different from what Dr. Zobo has just mentioned about the UK. So for Kenya, if you wanted to come and work here as in a diagnostic laboratory, the starting point is that you must be registered by the Kenya Medical Laboratory Technicians and Technologists Board. And so that has to be a starting point for you to work in a diagnostic lab in Kenya, if you're a lab technologist. And so once you get that registration, then you're, I mean, you can apply for any job opportunities in that space. However, if you want to work, for instance, in research work, then getting this sort of board registration is not compulsory because then you're really not doing, carrying out diagnostics that will actually directly impact on patient treatment. So it depends on what your interest is. You want to get into diagnostics or service, or you want to get into research work. So the requirements are sort of different. I see Fatima has added a comment, someone with master's who is interested in diagnostic field in Kenya. So of course, my follow-up question to Fatima would be, is this a master's of science degree? Is it a science in medical labs sciences? Those are some of the questions that would actually inform whether or not you'd be registered by the Kenya Medical Laboratory Technicians and Technologists Board. As I alluded to earlier, when we were commenting on Glenda's question around integration, I think I have a problem with the whole issue about ring fencing. And I don't know who would actually resolve this issue, because I see it playing out in many African countries. Even Nigeria, I think, have a similar problem, where people just focus on ring fencing, despite acknowledging the fact that even something like laboratory medicine practice is multidisciplinary in nature. And so I think we need various stakeholders to actually sit down. And the stakeholders are not only the lab professionals. The stakeholders include the patient, is a stakeholder. The stakeholder includes anyone who is investing, including government and private entities. And just envision, what do we actually want for ourselves? And we have multidisciplinary bodies or councils making decisions. So then no one cadre then sort of tries to ring fence the profession. Then that way, then we actually look out for the interest of both the patient and the interest of the profession, and not just preserving silos and ring fencing. Thank you.
Thank you very, very much. I think those are such valuable comments, and definitely leads us to need broader consultation and more discussion. And I think this discussion needs a lot more time, but we actually are over time already by quite a few minutes. So we need to end the discussion, and I am very sorry about that. And it's I again just want to thank the speakers and all of you for being here, because for me it's been a privilege to listen to you and to be associated with all you. And I would love to meet you more and have more of these discussions. But I think I have to end, and I have to hand over to Dr. Ian to close and to formally thank everybody. But before I do that, I would like to thank him for driving these webinars and seminars and this African consortium, because in the few years that I've been involved, it has made such a difference to connecting us all across Africa. So I'd like to thank you, Ian, for doing this. And with that, hand over to you to give us some closing remarks. Thank you, Ian. Over to you.
Thank you, Prof. Davison, for chairing the session so well. And I would like also to thank the presenters, Dr. Zobo and Prof. Omuso, for such insightful presentations, and also Giza Chow and also Dr. Bettina Chale Matsau for your contribution. And I would also want to thank the Empower School of Health team who were behind the scene to make sure that all this is possible, the registration and all the communication are done. And also the University of Zimbabwe, the Department of Laboratory Diagnostic and Investigative Sciences, Cape Peninsula University of Technology, Department of Biomedical Sciences, Stellenbosch University Division of Chemical Pathology, and University of Pretoria Department of Chemical Pathology, and the African Federation of Clinical Chemistry and Laboratory Medicine. These are the members of the African Consortium on Laboratory System Strengthening, and it is our vision and our desire to continue strengthening one another. We learn from within ourselves in Africa, and the more we share what we have, the more we can learn from one another. And we want to bring more of these hands-on discussions, real-life experiences, which are not only theoretical, but we want to be able to cause a difference in how we practice lab medicine in Africa. And all of us are welcome to continue participating, and we make these recordings available even after the session. So you can always log on into Empower School of Health website. You'll be able to play back and also share with colleagues who are in your lab who were not able to be part of the discussions, because our aim is to continue strengthening one another in the African lab. And we note even a colleague who is from Sierra Leone who has even shown the desire for specialization in laboratory medicine because it's not available in their country. From these forums, we alert one another of possibilities, and we also can be able to mentor one another in order to improve the practice of lab medicine in Africa. We cannot do it on our own. We need each other. The consortium is for all of us. And I would also want to thank all of you, the participants, for taking your time to be part of the forum. And I hope you will spread the message. Let's spread what we have learned. Let's keep improving the labs in Africa. As we celebrate the Laboratory Professionals Week, let's continue to walk with our heads up as the lab professionals who are contributing in the African continent. I want to thank you very much. Let's have a good day. Let's continue the celebration of the Lab Professionals Week, and also note that we'll continue to have the forums like this. We'll have another webinar on 28 July 2023 on laboratory logistics. Look out for the advertisements, and please do register and share with your colleagues, and let's have a good day. Thank you very much.
Thank you so much, Ian. Thank you very, very much.
Thank you.
Thank you very much.
Thank you. Bye-bye.
Thank
Bye.
you. Bye-bye.
Thank you.